I first got a call from Alex's treating surgeon in September of 2014 after he'd undergone a pretty serious injury at work involving the gunshot.
On September 12th, 2014, I arrived to work at Blooming Grove Barracks. When I arrived, I heard what sounded like fireworks. I went up to the front of the barracks to check on what was happening, and the next thing I know is that I was shot and wounded through the hip area. I believe it was about a week in a medical-induced coma. I found out that I had a shattered hip. I just knew I couldn't move my right leg. I had no feeling in it.
They had initially performed several operations to try to save his hip, and we got the call after he became infected and had some problems with hip stability.
Yes, Dr. Wellman did surgery on my infections that I had. From what I recall, I believe he said it was about a 5-hour surgery, which was long, but he was pretty sure that everything worked out with it.
In the beginning for Alex, what needed to happen, because of the infection, is all of the original hardware needed to come out, and we need to give him a chance to clear the infection before doing any reconstructive work. And so my role in all of this was essentially to set that up. Clean out the infection, get out the hardware, and essentially get the tissue bed ready for Dr. Mayman to come in and do a hip replacement.
I got a phone call from Dr. David Wellman, one of our trauma surgeons here. He said, hey, I've got this guy, one of the state troopers who was shot by a sniper up in Pennsylvania, and he's been in hospital there. He's got some pretty severe pelvic trauma. I'm bringing him down here to take care of his pelvic trauma, but it really destroyed his hip as well, and he's going to need surgery on his hip. I need some help. I think it's going to take 2 of us to take care of this. The bullet that he was shot with went in through his back and actually came out through his hip. So it went through his pelvis, did a whole bunch of damage to the bones around his pelvis, but really kind of blew apart his hip joint as well. The damage really kind of crossed specialties, which is why we really needed the 2 of us.
I felt like I was 80 years old just because of, when you hear hip replacement, you think, you hear older people, elderly people. I'll have to say that that was the easiest surgery that I went through, due, I think, to Dr. Mayman doing the procedure. I remember waking up afterwards, and I believe it was like 7 hours after the surgery, they had me up and walking, and I was hardly in any pain or anything. It was amazing.
When I first saw Alex, they wanted me to evaluate him because he had had a nerve injury, an injury to the sciatic nerve as part of the gunshot wound. Dr. Mayman spoke with me and said that he would like to do a hip replacement, that he needed a new hip in order to have a functional hip, but he wanted to be sure that there was going to be enough nerve and muscle tissue working so that if he did the hip replacement, he could use the hip properly.
Dr. Feinberg usually does what they call an EMG test. I call it the nerve test. It's a nerve conductivity test from all the way up into my hip area, all the way down to my toes, and what it basically feels like is almost like a little needle going in your leg, your skin, and he has, it feels like an electrode almost going and hitting the nerve and trying to get a reflex. So he's trying to measure how much nerve sensation I have and where I have it in my right leg.
So the nerve test was done, and I found that there was pretty good nerve function, but I also was able to tell that the nerve function was going to even get better, so that a hip replacement would be a really good procedure to do.
He's still recovering from that neurologic injury. He's done incredibly well. The last time I saw him, he walked in here without even using a cane. Honestly, myself and Dave Wellman, every time we see him, we're amazed by how much recovery he's made.
I just remember when we got him, he's supine in a hospital bed where he's been for weeks. And I think one of the things that you could see from him immediately was he was going to fight, and he did fight. And, giving credit in this has to also go back to Alex. I mean, you have to have the right specimen for something like this, and Alex has been fantastic.
So I'm really looking forward to seeing Alex again. Last time I saw him, we were seeing some recovery. He was really excited. And so I'm hoping on the next visit that we get to see additional recovery, and there's recovery down below the knee into the leg, and he has some ankle function. If I see that, I mean, it's going to be a really big moment.
The physicians at the Hospital for Special Surgery greatly helped me with getting back. It was the combination of their great care, the medical staff there, the surgeons, Dr. Mayman, Dr. Wellman, and Dr. Feinberg, and what their specialty was and their experience that they have got me back to where I am today, up and walking.